Hey guys, we're the Disease Defense Team and welcome back to our podcast where we talk about our unusual cases. My name's Daniel and today with us we have Braden, Ava, and Samantha.
Howdy, I'm Braden.
Hey, I'm Samantha.
And I'm Ava.
And on this episode of our podcast, we'll be talking about a recent outbreak at the local hospital called Garcia Newgard Memorial Hospital. Now this was an interesting one.
So, as the DDT, we have certain steps that we take when helping resolve outbreaks in healthcare facilities such as hospitals, clinics, and laboratories. When we created these steps, we made sure that each step plays an important role in figuring out not only the infectious agents of an outbreak, which we will get to later, but also the source and origin of an outbreak.
So the sequences of events is the DDT receives a call or an email from the healthcare faculty.
The DDT then has an epidemiologist who gathers initial information.
The healthcare faculty extends a formal investigation for DDT to help lead on the site system.
The DDT arrive on site and help gather additional information from the interviews, case charts reviews, observations, and conducts patient testing.
The team analyzes this information to identify risk factors for infection and help develop control measures.
The DDT recommends new or revised measures to steps to prevent more patients from being infected.
Healthcare faculty implements recommendations and checks to ensure the control measures are working.
Following the conclusion of the on-site investigation, group communications continue to review what has been worked on and make adjustments as needed.
Now we had 11 patients showing unusual symptoms, so the first thing we have to do as a group is try and find a common issue.
A lot of the patients varied in the age and health conditions, which made it difficult to identify the common issue for our team. We have from as young as a 5-year-old to as old as a 76-year-old, varying in gender, health conditions, and patient history.
But the one thing we were able to identify that was common between all of the patients was that they didn't have these symptoms until a few days into their hospital visit. This would be classified as a nosocomial infection, or a nosocomial infection. This is also referred to as a healthcare-associated infection, and they're infections that are acquired during the process of receiving healthcare that was not present at the time of admission into the hospital.
So, the different infectious agents that you can get from a nosocomial infection include prion, bacteria, helminth, virus, fungi, and protists. These infectious agents can infect you, causing different diseases to manifest in your body, causing different symptoms like nausea, fever, itching, and coughing, as well as tissue and organ damage. And that's just to name a few. There are many other awful symptoms that can happen to just about anybody.
Now, these infectious agents you can get from any type of disease, but to further describe them, a prion is a type of neurological infectious agent that messes with your brain. Bacteria is a living infectious agent, such as E. coli or such. A helminth is a type of worm of an infectious agent. A virus is an infectious agent that takes over your cells to reproduce. This would be like COVID. Fungi is a type of infectious agent that you get from touching the spores. And a protist is kind of like a combination of some of them that don't really fit under a specific category.
So we'll have an example of one of our patients. Imagine you're a 5-year-old boy. You have been diagnosed with leukemia at a young age and are constantly in and out of the hospital. You develop a deep, painful cough and lumps under your skin. You watch as your doctors are trying to figure out what infectious agent is causing your problems. So, Braden, how do we figure out what disease the boy has?
Well, we have to move on to our next step of our investigation, which include finding commonalities and differences between the patient's whereabouts, the staff and their location, and tools and utilities used on and around the patients.
So this was really difficult for us because as we talked about earlier, our patients range in all sort of areas.
We first looked at where the patients were in their location with the other patients and found nothing in common. We looked at the different floors, the OR, the ER, and the ICU. When we didn't see anything with the patient's location, we then looked at the staff. We looked for anything like the staff's whereabouts, their hours, and what type of healthcare officials came into contact with the patients. We saw that there was no way the staff could have transmitted the disease to the patients because not one single staff member was able to give the disease to every single patient that was infected. We finally looked at the cart locations, which told us what different items or tools were being used, where they came from, and where they were being used in the hospital.
We went through the entire cart locations list, and we thought the causes of the disease could have come from two things: the IV tubing or the antiseptic wipes. We quickly proved that the IV tubing couldn't have been the cause of the mysterious disease because it was not used in every single room of the patient that the patients were in. Therefore, there was no need for all the patients to get the same infection.
So we finally found the cause of the disease, which was the antiseptic wipes. Now that we know what caused the disease, we now have to figure out how the disease was transmitted.
So there's a basic type of way that diseases are transmitted. It starts with the agents of disease, as we talked about earlier, which is prions, viruses, bacteria, protists, fungi, and helminths. And these are inside of a reservoir, which could be a person, an animal, or the environment. This then gets transmitted through the person by their skin, their respiratory tract, their gastrointestinal tract, their urogenital tract, or their conjunctiva. The mode of transmission would be direct or indirect. A direct mode of transmission is a disease transmission that occurs when a susceptible host touches an infected individual or is exposed to their body fluids. An indirect disease transmission occurs when a susceptible host inhales infected particles, touches an infected object, or is bitten by an infected insect, basically not directly touching the disease. This then would go through another person's portal of entry, which would be a skin, respiratory tract, gastrointestinal, urogenital, and conjunctiva. And the people that would be getting this are the susceptible hosts, which people that are more likely to get a disease are the children, the elderly, people that aren't immunized, and people with weakened immune systems.
So let's go over what we need to know. Since we ruled out IV tubing, we really had to look at how the disease was being transmitted. So how did we figure out what the indirect or direct disease transmission was?
So we know that the antiseptic wipes were used on surfaces and tools which sometime the patients came into contact with them.
Yeah, you got to remember that a lot of our patients they vary in age. So a lot of these are old people, but then a lot of them are kids. And kids are always touching surfaces and putting them into the mouth. So it's really, really common for diseases to enter the body through that.
So we need to know the specific infectious agent and also the specific disease so we can treat the patients.
So let's go over gram staining. Gram staining was really important because that's how we kind of identified what infectious agent we were dealing with. So using a circular motion, mix the bacteria into the drop of water on the slide. You want to make sure the uniform smear on the center portion of the slide. The smear should look like thin, faintly cloudy film on the side. That's how you know that you have the bacteria on it. So you then want to flame your loop to allow the water to completely evaporate on the slide. Hold the slide at the edge and carefully press the center of the portion of the slide through the flame 3 times.
Then carefully add the crystal violet dye to cover the center of the slide where you made the bacterial smear. Add only enough to cover the area. Do not overflow the slide. Allow the dye to remain on the slide for 1 minute. Using a bottle filled with water, gently rinse off the dye. Do not wipe or dry the slide. Do the same thing, but instead of crystal violet, use iodine. Hold the slide with your gloved hand at a 45-degree angle lengthwise, like a slide at the playground. Add drops of the ethnical alcohol to the top of the slide and allow the alcohol to run down the length of the slide. Continue this until no more color runs down the slide, usually about 15 or 30 seconds. Use a bottle to carefully rinse the slide with water.
Do not wipe or dry the slide. You would then carefully add the dye saffronin to the center portion of the slide.
Allow the dye to remain on the slide for 1 minute and then carefully rinse the slide off with water. Place the slide between the 2 pieces of paper towel and press the towel onto the slide. Wipe the bottom of the slide to remove any excess stain or water so you do not damage the microscope stage. We then looked under the microscope for different morph structures.
After all this, we figured out that the infectious agent was bacteria and the specific disease was Staphylococcus aureus. This is the most dangerous of many of the types of common staphylococcal bacteria. These gram-positive, spear-shaped bacteria often cause skin infections, but can cause pneumonia, heart valve infections, and bone infections, and also the symptoms we saw from our patients. How we treated the patients was an antibiotic called linezolid. This is a prescription drug that's used to treat only serious bacterial infections. It works by stopping the growth of the bacteria. It treats only bacterial infections because it's an antibiotic, which means it won't work for viral infections such as the common cold or the flu.
So the way that we found this out was whenever we were looking at the lot numbers, we realized that a lot of the antiseptic wipes had been called back by the FDA, and yet somehow they were not called back in the hospital. So after all the sick patients had gone through, the nurses or whoever would clean the countertops, which then transmitted the disease.
So if you do come into contact with someone who has Staphylococcus aureus, please be sure to wash your hands thoroughly, scrubbing for at least 10 to 15 seconds in order to make sure you get all of the bacteria off your hands. Make sure to keep your cuts and scrapes clean and covered with bandages until they heal to prevent you from getting infected. Avoid contact with other people's wounds or bandages. Do not share personal items such as towels, clothing, or cosmetics. Be sure to contact your doctor if you show any symptoms of staph such as nausea, vomiting, diarrhea, and dehydration, as well as any other symptoms that the patients had in our disease, so they can give you antibiotics to fight off the bacteria. Also, make sure that you use proper cleaning tools in order to ensure that you are properly disinfecting surfaces and yourself.
There are minimal things that the hospital could have done to prevent disease, but there are some things they could have done.
Making sure to look for recalls put out by the FDA, regular sanitation, etc. Also be sure to take out items when they're recalled and try to sanitize anything that might have been contaminated by the recalled item.
Thank you for listening to our podcast. We hope you enjoyed this unusual outbreak and learned more about what we do.
We appreciate you taking the time out of your day to listen to our defense team, and we hope you got as much information as needed.
We hope to see you again on our DDT podcast.
Thank you and have a great rest of your day.